Welcome to the PAs In, the show created by PAs for PAs, where codependency with your supervising physician is a thing of the past, optimal team practice is the future, and physician associate has taken the place of physician assistant as the professional title of choice. Today, I have not one, but two special guests talking all about the situation with PAs in Puerto Rico. So, my new friends, Laura Juarez and Kimberly Weichel are going to talk all about what's going on with PAs in Puerto Rico, the specific challenges that are being faced, the healthcare inequality, and what we can do about it as PAs who are working and living in the US. I love these two ladies and their passion for sharing this message about what is happening with PAs and for PAs in Puerto Rico and what they are doing about these disparities to make sure that PAs can help to play a role in what's happening in Puerto Rico. So without further ado, here they are, Laura and Kimberly. All right, Laura and Kimberly, welcome to the show. I'm so excited to have you.
Thank you so much.
Thank you for having us.
Awesome. So if you guys could introduce yourself to our listeners, let them know who you are and a little bit about yourselves.
Sure, I'll go first. My name is Lara Juarez, and I am a PA, an asociado médico. I am originally from Oklahoma, went to school at the University of Utah for PA school, and also got a master's in public health, and met the love of my life, who is in the military, so we moved to Puerto Rico. And that's kind of where my story for today is going to start.
Cool. And Kimberly?
Hey, everybody. My name is Kimberly Weichel. I am a proud asociado médico, currently living in Denver, Colorado, and working at the University of Colorado in OBGYN. And Laura and I's story started just a couple years ago where we became fast friends when we worked on a paper together about the importance of PAs in Puerto Rico. And we are both so passionate on this subject, and we're super excited to be here.
Awesome. So let's dive right in. So tell us what's happening for PAs in Puerto Rico. What are the issues? What's going on for us there?
Yeah, sure. So this is such a loaded question, and we have so much to go over, and we're super excited to do so today. Laura and I just wanted to start off by also including, as kind of part of our introduction, that both of us are proud board members of La Academia de los Sociomédicos de Puerto Rico. We call ourselves AMPER for short because I think you would get exhausted of saying the full title constantly. And so we also wanted to open up with talking to you, Tracy, and your listeners about the proper title for the profession for physician assistant, physician associate. And this title has been endorsed by the AAPA since as early as 1998, believe it or not, and then was most recently re endorsed by the AAPA this past year at the annual conference. And so the proper name in Spanish for the physician associate is asociado médico. So we wanted to take all of the listeners back to their favorite class, which is Spanish class, and to kind of teach everybody how to properly introduce yourself in Spanish. You're walking into your patient encounter, you would say, Hola. For me, I would say, Hola, me llamo Kimberly, yo soy asociado médico. Asociado médico is considered a proper noun. So if you remember back to Spanish class with some terminology, you would change it to be the A or the O based off of masculine or feminine tense. But with the asociado médico, it's quite simple because it's a proper noun. You don't need to do any of that sort of translation. So, hola, me llamo, insert name. Yo soy asociado médico.
And we should be saying that even if you're using a translator or the language line, because I'm sure that the very sweet translators sometimes might not know the right terminology. Do you guys hear that getting misinterpreted sometimes?
Yes, actually, yeah. We were just actually talking about this the other day and how, as Amper, we want to kind of make one of our goals is to reach out to the larger translation services and even Google Translate to make sure when you type in physician assistant, physician associate, you're getting asociado médico back.
What are they sometimes saying and how is that interpreted? Like, if you don't introduce yourself and you rely on the translator and they say something else, what is the patient like? Do they think you're a medical assistant? They just don't know who you are or what you do? Like, what are they misunderstanding when we don't say Asociado Medico ourselves?
Yeah, so I would say the most common translations you'll hear are médico asistente or asistente médico. And this is not, I'm really glad that you're bringing this up, Tracy, because this is not just a uniquely Puerto Rican problem. This is a Spanish language concern. And so the asociado médico is definitely what we want to make sure is being used. And Laura, were you going to say something? I'm sorry, I didn't want to talk over you.
No, just that there's variability, from Puerto Rico, whether it's Spanish, Mexican, from Spain, or anywhere from South America. I've been called La PA or just medico or doctora. So any number of things, but we'll kind of dive into why it's so important for us not to use that asistente, and also why now is such a perfect time since in the States and our English speaking title change, we have endorsed physician associate. So now is the perfect time to really jump on this for our Spanish translation.
And I think as a provider who mainly speaks English and doesn't speak Spanish as well as you guys, to me, if I'm going to start calling myself a physician associate, asociado medico, like it just makes more sense relative to that new title. So I think it's going to be even easier to understand going forward. So what kind of is the culture or situation with PAs who are practicing medicine in Puerto Rico? What does that look like? What are you guys up against? What challenges are happening there?
Yeah. Yeah. So I think it might be helpful to kind of go through a little bit of a brief recap and a timeline of the fight that we've been fighting in Puerto Rico. And Laura and I just kind of wanted to mention that we are by no means the end all be all. We have amazing team members, and I would say there's been a lot of changes in the past like 6 to 7 years, but the fight has really been going on for the past 20 years. And there are some key players we definitely want to give credit to. A couple of those people include Marian Ramos and Luis Ramos. They're colleagues, but they'll tell you in person that there's no relation, though they share a last name. They make that joke quite commonly.
All world,
And
you
yep,
never know. Yep.
exactly. Manuel Guzman, and then of course the PAs for Latino Health is a major contributor to the past historical efforts for getting PA practice in Puerto Rico. And then there was also, before we created AMPER, there was a special interest group through the AAPA named PAs for Puerto Rico. And so all of these kind of cohorts and individuals have really had played like an integral role in getting the profession on the island. And I don't know, Laura, do you want to kind of dive right into the law?
Yeah, sure.
Would that be a good starting spot?
Yeah,
Okay.
so we definitely want to kind of get the attention of everyone um, because this is a huge, like, it's kind of like a rock that's rolling down a hill, gaining momentum, but we need help. We need a lot of help and support. And so the message that we really want to get out is how this can kind of affect our stateside colleagues and also what they can do. So the first thing that you need to know is that when the law was originally passed in 2017 in Puerto Rico, it didn't use the title that we just made a big deal about saying was the right title. So it used medico asistente. Now, here's why that's a problem, because it essentially created this umbrella term that Puerto Rico has used to group PA or PACs, so certified PAs, along with some other medical professionals, so foreign medical graduates and those at a varying number, a different stage of their training and taking their boards. So that's the first thing to know is when you're speaking in Puerto Rico and you say medical asistente, they will assume that it is this umbrella term. So the other tricky thing about the law was that it did say that they can sign PA after their name. So it's not just the title, it also includes those initials PA. So that's a big deal. Some things are the same. Every medical assistente is required by law to have a supervising physician, but here's where it goes downhill. They must sign everything from your order for a CBC to your daily progress note to you asking to get a chest x-ray. Um, Anything you want to do, you have zero autonomy or independence to make that decision. You also cannot legally prescribe any medications at all. And then finally, a supervising physician can have no more than 2 PAs working under them. But if you have multiple specialties, then you can have more than one supervising physician. So that's where we're starting with the law.
Which just to me sounds not only unclear professionally across the board, like who's who and who can do what and who's at what stage of their training, or if you're actually a certified PA, like you're not in training, you don't need that degree of supervision. You've been trained to have that autonomy. But the way that it's written, it's confusing. It's unclear for patients. They don't know who's taking care of them. Like it's like if instead of introducing yourself as a PA here in the US, you just said like, oh, I'm part of the team. Like they wouldn't know who you were because you're not specifying who you are as a part of that team. So what needs to change so that PAs can function in the way that they've been trained in Puerto Rico?
Yeah, so I think one of the major efforts that AMPER is really working on is finding a Puerto Rican legislator and Puerto Rican physicians and kind of those grassroots efforts and community workers in supporting our profession. So I think, obviously, I think the ultimate goal is to get our own law. We'd like our own law that represents our profession and clarifies our scope of practice and allows us to really do our job, right? Extend the hand of the physician. There's a lot of healthcare disparities on the island, and our profession has shown that we can help with that. And that's truly, ultimately our goal. But how to get there has been quite challenging. And one of the other major goals of AMPER is both patient education, teaching people kind of from ground zero, what is a PA, what can we do, how can we help you, and then the other thing is also um, teaching the physicians, right? Some of these physicians that are on the island have never trained in the States. And so maybe they've never even heard of our profession. They don't know that there exists this alternative provider that can truly come in and help them.
If you only take one sheet of paper to your next negotiation, let it be the PA Pay One Sheet. It's a tool designed to walk you through setting up the ideal outcomes, assessing the situation you are negotiating in, and it even includes a reminder of which negotiation skills you can use. Stop what you are doing. Download the one sheet, print it out, fill it out, and literally bring it to the table with you when you are negotiating next. It's designed specifically to work in healthcare settings wherever you are. You can use the PA One Sheet to get the best deal, the biggest raise, and to help your confidence walking into your next negotiation. Head to www.tracybingaman.com/one, that's ONE, to download your free copy of the PA Pay One Sheet and start prepping for your next negotiation today. It's linked in the show notes, but in case you missed it, it's at www.tracybingaman.com/ONE. If someone is listening to this and they're like, honestly, I get why this is important, but I practice in the United States of America, right? Like, how is this ever going to affect me? What can we say to that person about why this matters? Even if you
Yeah.
have no plans to go to Puerto Rico, you never plan to practice there, how does this affect our stateside providers?
So, one thing, if let's say that the listeners are keeping up with AAPA and they just went to the town hall where they talked about the interstate licensing compact, or let's say they're really following along with those PA leaders that are in virtual and telemedicine, then they would know that a lot of providers that are wanting to work across state lines are trying to get that reciprocity in different states, or be recognized or be able to prescribe across state lines in the States. Now, when I have my, hat on for Puerto Rico, then I think, well, for stateside trained and certified PAs that want to practice on the island or do telemedicine or have reciprocity, that sounds awesome. Bring it on. However, it's a big red flag that going the opposite direction, right? Because right now, if we try to find out, okay, so who is it? Who are these people, right? Who has a PA license in Puerto Rico right now, or the medical asistente license? The data is not available to us openly. So we had to do a little digging. We've done our own kind of survey monkeys from people that will respond. But I know that I applied to get the license when I moved in February of 2019. They didn't know who I was or what to do with me because I did not have a medical degree, like from a medical school. So they immediately said, I was denied. So it took several years and additional money under the table to really get the license. And the number on my license was in the 900s. So from our surveys and things, it appears that there are over 1,000 people in Puerto Rico practicing as a medical asistente or a PA. When asked how they self-identify, most of them seem to be from Mexico, Cuba, and the Dominican Republic that went to medical school there, but have just stopped after the 4 years of schooling itself. So that means no residency, no intern year, which we know that there are, generalistas or the old school like GPs in the States that used to practice that way. But we're not even talking about that level of training, because these individuals not only haven't done that, they also haven't passed their step 1 or step 2 USMLE.
Mm. So they're like a junior physician and not really haven't completed their entire physician training. So really, under this umbrella or with this license, it's very unclear who's who and who can do what safely and to take care of patients effectively.
Yeah, and we have to remember the ultimate goal from this law. So the law itself is called La Ley 71, which translates to Law 71. So the goal for this law originally was to kind of extend healthcare providers on the island by any means necessary, right? There are, another reason that this is so important for listeners who maybe aren't Puerto Rican, don't plan to ever move to Puerto Rico, don't have Puerto Rican family, is that Puerto Rico is a US territory, right? So that means every single person born, raised Puerto Rico that's come to the States, it doesn't matter. They are US citizens, right? And they are suffering. They are suffering. They've faced numerous challenges. Everybody, if you're somebody who's in the United States, you've seen the news. You know that, Hurricane Maria, the earthquakes. Puerto Rico has faced so many natural disasters over the past years, and in addition to that, they're struggling with healthcare providers. Right? There's barely any physicians left on the island. People are struggling to get in to see the doctor, and so as PAs, right, we take this oath. We take this oath to care for every single patient. And I would love to believe that if, we can better educate the rest of our community, that more people will continue to step up to help Amper, to, potentially maybe want to move to Puerto Rico. If you ever vacation there, it's one of the most beautiful places in the world. And so that's kind of one of our goals too, is to kind of just educate our PA community, because one of the things that Laura and I find is that people just don't know that this is a problem. I remember when I first started working on this project in PA school, none of my peers in PA school knew that PAs couldn't practice in Puerto Rico. None of my faculty even knew. And so we find that, people become very passionate when they learn that there's a place with such healthcare disparities, and yet our profession can't do its job.
We've also tried hard to reach out to people of Puerto Rican descent or heritage that are PAs in the States. And, tell us your story. would you like to move back, to the place of your heritage? Do you have family still on the island? And the answer is always yes. Who doesn't want to feel like they are home? But they also know that yes, you can move. And yes, you can be one provider that maybe finds one doctor that understands what you can do. But in the big picture of things, we've got to find a way to make a bigger impact.
I mean, what it sounds like is that there would be providers who are willing to serve these people in this place if, and this is a very big if, there wasn't so much friction. If they didn't, if they didn't know, it would have to be the perfect place, the perfect setup. You've got to, it takes years to get licensed. Like, people don't have this ability to put their life on hold for 3 years while they get things figured out. And it sounds like something that you have to be on the ground there to really accomplish, or at least be going back and forth, so that in order to get qualified providers there, there's really a lot of barriers in place to getting the care and the people who can provide the care to the people who need that care.
Yeah, I think there's one more thing, to point out, and that is the physicians that are on the island right now. They are working their tails off and they're getting paid nothing. And it's very, very difficult. So if we say that the island has around 3.2 million people, right? If we're guessing, the best data we have from the AAMC, which is the Association of American Medical Colleges, says that there's less than 10,000 active physicians on the island. So if we try to put that in a little bit of context, we picked out, okay, what are some specialties, or what is primary care? That means that there's 1,872 family medicine practitioners for the entire island of Puerto Rico.
Oh, yeah.
Mm-hmm. And the shortage doesn't just stop with physicians. I mean, there's nursing shortages, there's OR staff shortages. And so, yeah, it definitely creates two kind of unique challenges, right? Like, there's challenges in delivering primary care on the island, and then there's also challenges in delivering specialty care. And so Puerto Rico is also right now facing a shift in their population. So the age of people in Puerto Rico is much older in comparison to stateside. And then also in addition to having, less family providers in general, the family providers that are on the island are reaching closer to the age of retirement. Yeah. And then I think some shocking statistics that can really kind of catch people's attention is that in the delivery of specialty care, so there are many specialties on the island where there are less than 20 providers. So some of those include allergy, immunology, interventional radiology, or cardiology, excuse me. And so this means that patients that need the care of a specialist on the island are needing to wait months and months, 6 months to a year, to see a specialist. And another kind of barrier to access to care on the island is that, if similar to in the States, a lot of your your specialists are located in metropolitan areas, right? And then in Puerto Rico, the main metropolitan area is on the east side of the island, which is in the capital of San Juan. So for those patients who are living in the mountains of Puerto Rico or on the opposite side of the island, it can be very challenging to get to an appointment across the island. And so this is just, another reason why PA our profession can just do so much on the island.
Yeah. Puerto Rico is about the size of Connecticut or so. So it seems like, oh, I should be able to drive that. But to put it in perspective, from my house to the nearest freeway, it takes me 20 minutes to get there to the freeway, and then wherever you want to go from there. So definitely some challenges.
Yeah. Now, are there people serving in a mission capacity where they're taking trips and being able to provide care? Is there a lot of barriers to that happening, or are we kind of able to go in and do the work that needs to be done temporarily as someone who's like practicing and licensed in the United States?
Yeah, that's a super interesting question, because I guess first and foremost, we want to be sensitive to not making it sound like the island is just tragically terrible and we need to come in and save everyone. Like, or that this is just a struggling, developing country. It's a place that has struggles just like everywhere else. And so they do, have people that are well educated and they've got great physicians. And when they've had these natural disasters, the earthquakes down in Ponce, they deployed people that were already here in the area. They responded, willingly and wonderfully. And of course, there's a presence for the American Red Cross, Samaritan's Purse, a lot of the international NGOs as well. Um, but it also leaves a lot of wiggle room for what I would call the Wild West, where, if you want to help, then by all means roll up your sleeves and get out there. But if that means that you're doing an I&D on the side of the road, without perhaps the proper training and without the follow-up care, there's no continuity of care, then it's like, well, is some care better than no care? And it's an ethical question that we're really wrestling with, because when we say, we don't want to be grouped in with those that have just graduated from medical school, then some are saying, yeah, but we need the provider so bad. You just told us we have to wait 3 years to see a genetic specialist. So isn't that okay? And it's a question I don't know that I have the answer for. I think we're trying to just take, when we talk about health equity and giving patients the care they need, health equity really means that level of care doesn't change, from place to place or person to person. And so our feeling is that if we know that a certified PA has graduated from an accredited PA program and they've passed the NCCPA PANTS, then we can put a stamp, behind that name and say, we believe that this is a quality and a standard, and hopefully that will translate into patient outcomes. It's a great study that we're dying to do. We're trying to learn how to write grants. We're trying to teach ourselves how do we get funding, because, Kimberly and I, we're not legislative savvy, and so we're just kind of
Yeah.
stumbling around trying to find our way. But again, that's why we are just dying for those with these skills and talents to jump in and help.
Mhm. I know one of the other interesting barriers, and by no means do we think that the PA profession is the end all be all on the island. Do we think that we can come in and we can help mitigate some of these healthcare provider shortages? Absolutely. But one of our missions, as the AMPER and as PAs that are super passionate on the island, is we want to make sure that we're uplifting the voices of the community. We want to make sure that we're helping doctors. Right now, one of the biggest struggles that we've had is that we've been able to reach out through the wonders of social media to some influential physicians and other like healthcare professionals on the island that are kind of fighting the good fight. And one of the things that they're really struggling right now with is that physicians on the island are reimbursed at significantly lower rates from Medicare, Medicaid, and private insurers on the island. And so what we found as a board is that when we reach out to these doctors, they say, yeah, 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 we like the idea of the PA profession. We think you guys can help, but right now I can't even think about you because I can't even put food on my table. I'm working, 70 plus hour weeks in the hospital and getting paid, pennies to do so. And so, as our profession is fighting to just get our profession on the island, we also want to kind of uplift those doctors' concerns and issues because we know that if we do get to work with them, those are going to be our concerns as well, right?
Yeah, it seems like that a lot of this up and coming generation of doctors on the island, they're really starting to stand up and they're finding their voice and they're saying this inequality isn't okay, and we've got to get the reimbursement, situation and insurance reimbursement addressed. Um, so we'd love to just kind of give a shout out to some of those people as well. Do you want, Kimberly, like people that we've connected with over social media that are out again, like rolling up their sleeves, getting the work done?
Yeah, because they've realized that one of the major driving forces for healthcare providers and for physicians from the island has been the fact that they can't make a good salary on the island, and they can't provide the care that they want to be able to. And so these individuals have really brought light to that issue. And so Carlo Bosques is a medical student on the island, and he's been super vocal along with Dr. Iram Rodriguez, who is an internist, in addition to Sergio Rivera Rodriguez, who is a PhD candidate in public health. And then also, believe it or not, there is a singer slash physician on the island named BJ Sinsuela is his stage
Love
name.
it.
Yes. Jack of all trades. And he is super vocal about the healthcare disparities on the island. And so we've been able to kind of reach out to these individuals, and they've expressed their support for the PA profession. But these are the professionals that have also given us feedback saying, we understand, we want to support you, but we don't have the bandwidth right now because we are literally fighting to take care of our patients, but also be able to care for our families.
Survive ourselves. Yeah, I think not unlike the way that pathophysiology and disease works, nothing happens in isolation. So none of these things are happening in a vacuum. So you're saying, hey, we're kind of here. We see you. We want to help. And sometimes you're like, well, we can't actually solve that problem until X, Y, and Z happen. And those things take time. And, sometimes even more so than legislation, like changing public perception, changing, the way that things are working, even outside of like these massive conglomerates that are insurance payers. And like, what a weird system that healthcare exists inside. Like, oh, this is what you need. You can't access it, or you can access it, but the person paying for your care has decided that you don't need it, even though your provider said that you did, even though you feel like you need it. That care is being dictated by the reimbursement. And I don't think any providers want to be second guessed. No providers want to be not able to do what's best for their patients. And certainly on the receiving end of healthcare, you don't want your care to be dictated by someone who's in some office somewhere writing policies to try and save their company money. So I don't think that this is a problem that we're going to solve in the next 15 minutes, right? There are things, there's lots of work to be done. So if someone is listening and they feel moved by what's going on and they're like, hey, I also don't know how to write a grant, or maybe they do. So if they do, definitely give you guys a call. How can they get in touch with you? How can they learn more about AMPER and all of the great work that you guys are doing?
Yeah, so number one, you can join AMPER. So we can be found La Academia de los Asociados Médicos de Puerto Rico, AMPER, on just Google. Our page will come up, so you can join as a member. We would love the support. We're on social media. So we have Twitter, Instagram, and Facebook. And then also you can sign our change.org petition, which has over, I believe, 1,200 signatures the last time we checked. There are translations in English and Spanish. You can share with your PA colleagues, and that would also gain us a lot of traction.
Awesome. I think that this is just such a wonderful thing to bring light to. And I'm so happy to be able to say, hey, to all of the people listening, you might not even have known that this was happening, but now your eyes have been opened to something that is happening not far from home. And to understand that there's this entire group of people who deserve to be able to see a provider and not wait months, and deserve to be able to see someone specifically for their heart, right? Like 20 cardiology providers for this massive amount. It takes my breath away thinking of, I actually earlier this year had an issue where I had to see a cardiologist, and then I had to see an electrophysiologist, and then I had to see an endocrinologist, and then I had to see it was like a big to do. But and it was scary, and it was inconvenient, but there was never a point in that process where I thought, I can't get what I need. And I am someone who I felt like I was fighting. I felt like it was uphill. Like I was having to say, yes, I know I look young and I know I seem healthy, but something is wrong. And I had to keep saying something is wrong. And I had to keep advocating and keep calling and keep insisting on what I needed. But all of that, even as hard and as scary as it felt, there was never a point where I thought, oh, I might just not be able to see these people. Like I knew eventually I was going to get what I needed. And the system is not designed for ease of use, even for someone who like has all the knowledge, has the resources, has the insurance, like lives in a place where like I probably have a cardiologist living in my neighborhood, right? Like they are everywhere. And still, despite all of those resources, despite like the perfect setup, it was still a scary, very stressful time. I can't imagine what it would be like to say, I don't know when, I don't know if, I don't know how. Like there are so many variables when you're ill or your loved one is ill or you need some care or someone's opinion. It just must feel so terrible just to not know if you can access it.
Yeah, so what that means for a lot of patients in on the island is that they have to uproot their lives, right? And they have to maybe if they have a family member living in the States, they have to uproot their lives in Puerto Rico and move somewhere where they don't know. Maybe they don't speak good English. You know the variables are have to be all laid out on the table. And so of course that is, also only reserved for those patients that have the resources to be able to do that, right? Yeah. And another reason, I don't know that we've mentioned it, but another reason why we've kind of got the put pumping the gas pedal pretty heavy on these efforts is that there is a 3 cohorts now of PA students on the island of Puerto Rico.
Mm.
So the first and only ever PA program is in San Juan Bautista, which is in Caguas. And they have 3 cohorts. So the first cohort of PA students will graduate in May. The second cohort has literally just a couple weeks ago started their clinical education. And then the third cohort a couple weeks ago just started their first year.
Awesome. I mean,
Yeah.
it sounds like, listen, progress is progress, whether
Yeah.
it's small or large. And even the fact that we three are having this conversation and going to share it with people, like that is not nothing. That is progress. That is sharing it. That is getting
Mhm.
more eyes, more ears to know that this exists.
Yeah, absolutely.
I know with your podcast, even when I read things, that you post and you talk about, wanting to make sure that women or PAs feel heard, the fact that we are having this conversation just makes us feel heard because it is really easy to feel like the whole rest of the world is just going on and nobody knows and nobody cares. Or when we say, hey, this is a problem, somebody pay attention, and everybody goes, that's, crappy for you, but my life kind of keeps going. So we really appreciate even being able to be heard by you and your listeners.
Well, we are so happy to have you. I think the wonderful thing about having a platform like this is that I personally get to have this front row seat to learning and asking the questions. And then in a couple of weeks to months, when we publish this podcast, I get to revisit it through the eyes and ears of our listeners and just get this great feedback. And whether it's strangers on the internet or people that I know professionally in my own life, it's been very fruitful to be able to shine light and to share what's going on in different parts of the country. I think even though the internet exists, it's still pretty easy to just get head down and be living in your own life. And not that you're intentionally forgetting that the rest of the world exists, but you're just prioritizing your own needs and your family and the things that are, coming up in your life. But it's so powerful to just zoom out a little bit. And one of my kids, he's in the second grade and he got this Chromebook at school. And I don't know how he came across it, but he discovered Google Earth, which apparently, when you're a 7-year-old boy, is like the single coolest thing that you can find on the internet. Like, yes. Like, he's like, what's our down the road neighbor's address? Like, I want to like Google Earth their house. And then he's zooming in and out. And it just makes me think about this ability that we have with technology and with using technology powerfully to zoom out from our own life and say, things are going pretty good over here. And what could I do? What resources do I have? What can I do to spread awareness, to talk about this, to join and support and say, here are my skills. How can I help here? It's just a really powerful reminder that your world is bigger than the normal orbit that you are in.
Yeah, yeah, that is so true. I mean, just at the board of Amper, for example, we are literally all in different places, and so we have just kind of been a Zoom family for the past like 2 years. And this past August, we had our first in person summit in Puerto Rico, and that was the first time I got to meet Laura in person. You know, this whole time, she's been between Oklahoma and Puerto Rico. I live in Denver. Our other members are mostly in Texas, and so just the fact that these platforms are enable us to just kind of work from these remote places on one common goal it is a pretty amazing.
And I think technology sometimes gets a bad rap, like, oh, technology is making us feel more isolated. And I certainly think that that can be true. But also, like, what a blessing that the internet exists and we can be looking at each other from three different parts of the world, and that we can have this conversation, and then that we can push it out and then other people can hear it. It's just like, I could go on and on. But I I'm so thankful that with all the things that you two have going on in your lives, that you took the time to share and that we all know a little bit more about what's going on. So tell us, like, what's the website, like where we can go one more time before we wrap up so everyone knows where they can find you guys.
So, the same place that you can find most of the stateside chapters, My PA Network, you can also find us there. And again, we like to use our title instead of saying the Puerto Rico chapter of PAs. We like to use Academia de Asociados Médicos de Puerto Rico because number one, it's in Spanish, and number two, it solidifies our name as being Asociado Médico. You can find us on Facebook, Instagram, and Twitter. And then we would love to meet in person. Kimberly and I just found out we've been accepted to present at the Fast 15 of the AAPA conference in Nashville. So come introduce yourself, join. We'll get you a snazzy t-shirt. We'll get you a cool pin, and you can walk around with your Puerto Rican flag, and we'll embrace you with open arms.
Awesome. Well, I will be there. So I look forward to meeting you guys in person in Nashville. And I hope that we have a lot of other listeners who are able to meet us and join in there. Thank you guys so much for coming on the show. This has been a blast.
Thank you so much.
Thank you so
Muchas
much for
gracias.
having us.
Oh my goodness. What an important reminder to zoom out of our lives and zoom in on other areas of the world and to use technology to break down the barriers that exist between us and those places. And to remember that we are incredibly blessed and that there are tons of resources at our disposal that we can use to help others who are in need. Thank you, as always, for listening to The PA is In. If this episode has helped you at all, if it helped you to realize that you want to take action, if the stories or advice we shared resonated with you, served you, or helped you to feel less alone in this crazy healthcare world, first of all, I am so glad that the show is meeting you where you're at. The very best way that you can say thank you is to head to iTunes and leave a 5-star rating and a written review. Helps other PAs just like you to find us and to know that this show is going to be helpful and to serve them. Thank you for tuning in to the show by PAs for PAs, where we help you to design your life so you can live long and prosper. It's your turn to get inspired, take effective action, and become one of those unicorn PAs who loves their job, has abundant energy, time to spare, work optional financial freedom, and cares enough about those around them to give of their time and their talents to help improve healthcare across the world. As for now, this PA is out. I will see you next time on The PA is In.